Hello, I am Orlando Ariola and I am a taxpayer. And as a fellow American taxpayer, I would like to spend the next few minutes talking about the Affordable Care Act, or otherwise known as the Obamacare. According to a U.S. government website, healthcare.gov, in 2010, the Affordable Care Act was first enacted. And since then, there's been a lot of controversy, a lot of partisan rhetoric, and a lot of issues coming up whether America can really afford to insure all its people. Nevertheless, in 2012, Congress upheld the law, and so we hope to see the full benefits of the Affordable Care Act by 2014. According to the WhiteHouse.gov, another U.S. government official website, 17.6 million children were denied health care because they had pre-existing conditions such as asthma and diabetes. Another 105 million Americans were also denied health care because of issues with cancer, another pre-existing condition. The Kaiser Report, a very reputable report, often reporting on U.S. government policies, states that in 2011, 48 million Americans were uninsured. The same report, however, states that working Americans who could afford insurance were paying on an average about $360 a month for family insurance and $79 a month for individual coverage. I find this kind of ironic in that I pay a lot more than that, and people that I've spoken to on this subject also stated that they pay a lot more. So if that is an average, that's a good thing. But nevertheless, I believe that as Americans, we continue to struggle with our insurance rates and the affordability. The New York Times states in a report that in 2012, our premiums actually dropped 30% as compared to 2010. So again, we may not be seeing it locally, but it is existing throughout the United States. It shows that there is hope. There is hope for affordability in insurance. The White House website also reports that fraudulent insurance policies and internal issues have brought up $10.7 billion in the past 3 years. $10.7 billion worth of penalties. So obviously we've got some problems internally just administrating the insurance. There are also policy concerns. Senator Rockefeller has stated that if we don't get on the right track, these issues will continue to surmount, and the application of the Affordable Act will become very complicated, and if not so already today, could really bog down as to how it's going to be applied in the next couple of years. So that needs to be improved. Coming to Texas, there's a report from the Texas Health, Human and Services Commissioner, and in that report he states that Texas won't be able to afford to support the Affordable Health Care Act. In fact, in the report, he states that Texas would be overburdened in the billions of dollars. So there's got to be a look at not only internal policies as to how insurance is administrated, but on a government level in legislation and through our processes. We need to see how we can afford to pay and maintain health care for all Americans. Taking into this consideration and agreeing that American health care is an essential element to our better good, let's look at hope. Let's look at the hope for the future. Affordable health care, as it's coming through, and hopefully through this act in 2014, there will be rebates if insurance companies don't meet the 80% level of providing premium dollars for our insurance. There's also going to be a requirement that insurance companies justify their rate increases. And there will be tax credits for employers, small businesses who provide insurance for their employees. Other benefits, accessible care. We're looking at by the 2014 there should be free preventive screenings, free preventive services. Young adults, 26 years and under, who are working but aren't able to get insurance for themselves should be able to work and maintain insurance under their parents' policies. That's going to be coming up in 2014. There's going to be an opportunity to select healthcare plans, and prescription drugs for seniors should decrease as well. So these are a lot of benefits that we look forward to in 2014. The Affordable Health Care Act is essential. Again, it's essential for all Americans. We can all agree, I'm sure we can all agree, that health care is a primary concern of us. And it exists today and in the future. We need to be able to take care of our families, ourselves, and America's growth and future. I hope that you're convinced that affordable health care is the best interest of all Americans, and I hope that you can see past the partisan opinions. This is not Obamacare. This is, let's call it America Care. Now that you've been informed of the Affordable Care Act, please advocate for its programs and for the well-being of America. So thank you, and be well.